Hello, this is Kathleen from the World Economic Federation. Today we will be talking about fixing the healthcare system as part of the proof of work system. Today, the healthcare risk pool is divided up into small, inefficient silos that drive up cost, while agreements between insurance companies and providers inflate costs for the uninsured. In the United States, healthcare, not irresponsibility, is the leading cause of bankruptcies in the country. Today, our healthcare system is inefficient, costly, and economically dangerous to those without added support or means. I can say that while John has benefited from his grandfather's estate, even still, were it not for his health care being covered by the VA, we would have likely had our resources diminished beyond repair. I met John when I was a professor at Baylor and he was an infantryman at Fort Hood. We joke that our first date was practically an interview for a permanent position. Even then, John insisted that affordable health care was critical to national security, whether it was for profit or nationalized. Further, he argued that the VA would always struggle for adequate support and funding to give veterans the service they deserve, as long as the health care system only applied to them. His argument being something to the effect of course a risk pool composed exclusively of sick people is always going to struggle. Veterans will not get the health care they deserve until everyone is on the same page, making sure the system is meeting everyone's needs. When it comes to funding, what does a politician care about funding veteran health care when pro-military talk is cheap and no one wants to actually fund it? Because it only applies to a small number of people that can easily be ignored, at little to no cost to the politician, with devastating costs to those who served and those who care about them. Almost 20 years have passed since that first date, and healthcare costs have only gotten worse for everyone, and politicians continue to shirk their responsibilities to the veterans. Furthermore, this is not a behavior unique to American politicians. How often does a government neglect the full costs of their military adventurism and put it on the families of their veterans? While he is glad he was able to serve, the mistreatment of the veteran community is a common source of frustration, as the people he served with do not have access to the same advantages he has had. That is why we intend another layer of the proof of work system to be meeting your healthcare needs. We intend for this to happen by selling healthcare to Federation participants and participating businesses at minimal cost, which would be further offset by a growing sponsorship pool to subsidize the healthcare costs. This way, in the long term, rather than having the healthcare industry drive up costs for fewer services, the costs are minimized by increasing the size of the risk pool and further offset by system subsidies. Not only would the larger risk pool and subsidies reduce your healthcare costs, but also you would benefit from partner access to the patent library, and if necessary, the systems being able to produce basic healthcare necessities independently if the healthcare industry is utilizing predatory, monopolistic strategies to maximize profits at the expense of people's lives, as has been done with insulin and EpiPens. You should not need to feel like you are jeopardizing your family's well-being by going to see a doctor, nor should you have to pay $400 for what should be $10 or free. Extracting profit as an act of extortion between a beloved family member's life and death is not good capitalism. But undermining the profits of those who do it is capitalism at its best. Not only are pharma bro revenue models morally and ethically reprehensible, but they are also an affront to basic human decency. If they want to let the free market decide between extortion and negligence, and a system that judges its successes based on people that are helped and how well, we would be happy to meet that challenge. Therefore, not only do we intend a sponsorship pool for healthcare, but also one for research and development of new drugs and antibiotics that we intend to be part of the patent library for our partners and our own production if necessary to break monopolistic price gouging. As stated, the goal of the subsidy system is to make it so that, as the system matures, your costs on proof of work services go down. In time, as subsidy sponsorships grow, those services will simply become included free of charge, fully supported by the Federation. Since the system is there to serve everyone, that means that the veteran community will ultimately get the care that they deserve, and the working classes do not have to worry about their own financial well-being while lending their voice to maximize the value of the health care on behalf of themselves and the veterans, as they now have a shared interest in the success of this privatized healthcare model that is accountable by the people for the people. We intend to make these healthcare packages as affordable and broadly available as possible in time, hopefully creating a global coverage pool that can handle global pandemics while they are still in their nation of origin, effectively fighting the virus there so we don't have to fight the virus here, if possible. Imagine this healthcare program as a global biological defense system with more interest in saving lives than delivering profits for a few shareholders, which eventually allows costs to go down as it matures. Naturally, with banking support, an LBO would also be available to take a healthcare network private, saving us years of development in building out a new healthcare system. But if necessary, this could be executed at a slower rate with more limited resources with a healthcare partner. That said, I am not sure how much the healthcare industry would care to compete with a well-funded healthcare proof of work layer with only an interest in meeting costs as the best possible outcome. One of the things I did appreciate about being a military spouse was that the military, despite its flaws, was far better at meeting the needs of their soldiers and their families so they can focus on meeting the challenges at hand, unlike most civilian employers that lack the basic understanding of how to get big things done. Unlike the civilian world, the bureaucracy there served the objectives of the military, whereas civilian bureaucracy is designed to prevent you from getting access to services politicians never wanted to pass and ultimately chose to sabotage. With Federation Healthcare, success in outcome, not denial of services in the name of profit, is the metric that shows you our proof of work. It was not a perfect system for obvious reasons, but in contrast, medical debt was not as much of a bankruptcy threat for us as it is for the general American population. Should you have to choose between having your parents or child for another few years or months and bankruptcy? How do you know that your healthcare provider is doing everything they can to protect and serve the life of your family members when they must first give profits to their shareholders? When profit is the main motivator, are the authorizations made toward survival and comfort or profit? Any system has limits, but how can you know that the system made efforts to work towards those limits if it is clearly more concerned with making money than serving your family? Does it make sense that an industry whose owners claim that it prioritizes providing the best healthcare and outcomes to Americans should be the leading cause of bankruptcies in the United States? How could a system that answers directly to you and has full transparency of its priorities, which are your family's health and positive outcomes, possibly do worse than a system that often perpetuates sickness and suffering in pursuit of profit with intent? If the road to hell is paved with good intentions, ill intentions are an expressway. No one is making you accept system-subsidized healthcare plans, and no one says you cannot supplement the options with third parties. Nor would you have to pay taxes to have those subsidies, because the subsidy all comes from the system-side revenue sponsorships. You would have access to affordable private health care over which you elect the oversight beyond your choice to purchase a subsidized plan. Furthermore, unlike the military healthcare system, TRICARE, the Federation system answers to the consumer of its services, making it more accountable than any parallel system today. We will make these plans affordable for the individual and part of the small business subsidy program until there are adequate sponsorships to fund the program beyond mere supplementation. In addition, People who want to enter into those medical fields in the Federation would have the education costs supplemented and then fully covered in time as the system matures. How could the Federation claim that it cares about the value of your life if we did not go the extra mile to try to extend and improve your life? Compassion and aid to the suffering is as much a religious ideal as it is a humanist ideal. It's not about agreement or disagreement with those who are suffering and what they deserve, but the values of the Federation. If the American healthcare system wants to compete with the Federation in terms of value, values, and the free market, we would gladly welcome the opportunity to throw our hat in the ring. Do you think your healthcare workers would rather work for a system where you, the patients, are a priority, or would they rather work to serve the administrative profits and overhead of an indifferent system? What is their proof of work for the services you pay for? Add to that the fact that veterans around the world will never get the care they deserve until everyone cares that it works well, and that happens by making that system available to everyone, transparently, affordably, and with the right priorities. Do you have family who refuse medical care because they don't trust the integrity of the healthcare industry to put their well-being before profit? Do you have family members who believe in complex conspiracy theories built around government corruption of the FDA on behalf of an industry that increases suffering in the name of profit? How many family members have you lost or have suffered due to not having a trustworthy healthcare system where they know they, not profits, are the priority? In matters of the compassionate treatment of patients, the standard should be to reach the limits of the system with the best trained and treated staff trying to meet your needs, not undercompensated and overworked staff who cannot provide care because a spreadsheet said your suffering is more profitable. If you have lost or suffered under a broken medical system, feel free to like, subscribe, and share this video so you can make capitalism pay.